So, Scott, what I'd like to do now is kind of go over the mini CEX today that you had with Mrs. Sweet, is that right?
Yes, Mrs. Sweet.
And what we're going to really focus on is the counseling, that you gave her. So,
good.
I just want to ask you first, how do you think it went?
I think it went really well. Mrs. Sweet is one of my favorite patients. She's really easy to talk to. She and I have a pretty good rapport.
Well, I actually thought it went pretty well, too. There's a couple things I particularly liked. First, I liked the way you explained the kind of the link between having diabetes and the symptoms that she's been experiencing. I thought that was very nice. Secondly, I like your tone. I just thought you were very empathetic, understanding, had good eye contact with her, you leaned forward, so I really thought that was nice. Okay. And then finally, I think, starting the Zocor because of her high lipids is very important. I think you pointed out the link again between heart disease and diabetes. The one thing I did forget to ask, though, is what were her LFTs? Were they normal?
I did check, and they were normal.
Okay,
yeah.
Great. Okay, good. In somebody like Mrs. Sweet, what sort of hemoglobin A1C are you going to shoot for in her?
Well, I really want to get her as close to normal as possible.
Okay, and what would that be?
7%, right?
Yeah, so, again, as close to normal would actually be more like closer to 6.5 or lower, depending on the lab. But I think,
okay.
The 7% is a good target, and then certainly want to get as low as you can, given that she's a fairly, young individual. So, no, it's very good. That's good. The other thing I forgot to ask you is that, did you look at her feet today?
I did. The only thing I found was a callus on both of her big toes, but otherwise they were fine, no lesions.
Good. Okay. That's great, because that's, as you know, very important to prevent future problems. Again, she's early in her course of her disease, but it's a good habit to start getting into. So, we rate these exercises, the mini CEX, on a scale of 1 to 9, and I would give you 7s for counseling, humanism, etc., and that would put you in the superior category. So I thought it went real well today.
Good.
What questions or thoughts do you have about the exercise?
No, I think it went really well, and I really appreciate the feedback.
Okay,
Thank
you're
you.
very welcome.
Thank you.
Good.